I know you're a big fan of getting quality sleep for somebody that's battling with an autoimmune condition. Talk about why that's so important in that case and what you recommend for them.
Yes. So yeah, I think the rest component is really vital. So with sleep, I think that that is when our body heals. So that's when it repairs damaged tissues, it regenerates. So that's so important for people with autoimmunity because if you're not really getting enough sleep, you're not giving your body the time and space that it needs to heal because it really does that during the process of sleeping. It varies a lot in terms of what people need that's optimal, between 6 to 8.5 hours. So the main way I tell people to judge it is if you wake up feeling well rested and you're not drowsy or sleepy during the rest of the day, then that means you've had enough sleep. And for each person, that might be a different number of hours, but that's a good guideline for sleep.
And do you feel like for somebody who's at least in the early on part of their journey with battling an autoimmune condition, they should be upping that sleep beyond that range you just talked about?
I think it can be helpful, certainly because sleep is really when all the body's healing pathways kick into high gear. So if you want to maximize that time, especially early on in the process, I think that would be highly beneficial.
All right, let's talk about some of the other things. Other than sleep, what can we do to make sure we're getting that rest and letting our body replenish like it needs to?
Yes, so I think addressing stress is really the big one. Another factor which we can come back to is addressing trauma, like even childhood trauma has been associated with autoimmunity. But with stress, like everyday daily stress, studies have shown that is associated with the development of an autoimmune disease and also associated with flare-ups and exacerbations of autoimmune disease. So at every stage, it's important. And finding a technique that works for you to manage stress is the important thing. Of course, I'm a big fan of meditation. It's got a lot of research for neuroplasticity, how it helps your hippocampus to get bigger, boosts your gray and white matter. It helps your focus and productivity. It prevents the age related atrophy or shrinking of brain cells. So, a lot of benefits of meditation, but it's not for everyone. And there are other tools in the literature that have been shown to be helpful, like psychotherapy, counseling, prayer, gratitude practices, forgiveness practices, going out in nature. For some people, journaling or exercise can be really, stress relieving. So find something that you enjoy and that you can do regularly, and that will address that mind body axis and help you manage your stress because it is really one of the biggest under emphasized factors.
Let's talk more about that exercise piece because the way I see it, there would be a you mentioned with salt, there's this U distribution where we want to find that sweet spot in the middle. I would assume for somebody with an autoimmune condition, when it comes to exercise, that would be especially important. They don't want to not move their body, but they also don't want to push it because their body is healing and going through this healing process. So for somebody that wants to adopt or modify their exercise routine as they're fighting an autoimmune condition, how do they find that sweet spot?
Yes, that's a great point because, I often see in my patients with autoimmune disease, sometimes too intense exercise can actually be counterproductive and worsen symptoms. If they're doing a lot of like high intensity interval training or CrossFit type workouts and, they have a busy job and 3 children and, life is very stressful as it is. In those cases, can be counterproductive. So with exercise, I always tell people that they should feel energized when they have completed it. Maybe like a little fatigue because of the exertion, but in general, it should not be something that you feel wiped out afterwards. If you do, that means that it's probably too much intensity, too much duration. So you have to find that moderate amount. And with exercise, I think three components are important. One is cardiovascular, so for the heart, getting at least that 150 minutes per week of walking, jogging, swimming, running, cycling, anything like that to get the heart moving. That's critical. Second is resistance training. This could be at least twice a week, either home body weight exercises like push-ups, doing a plank, or those things, or you can use weights or resistance bands or Bowflex. There's a lot of ways, but resistance against your muscle movement, that is very critical. And then the final piece, which often is overlooked, is balance and flexibility. So yoga is my favorite tool for this. Other options are, Tai Chi, Qigong, Pilates. But at least twice a week, I recommend people engage an exercise that helps their balance.
And when I think about exercise and putting that stress on the body, a good stress, but a stress, it gets me thinking about some of the other things we've talked about to this point, fasting, using a sauna. And I could see how for somebody that tries to adopt all these and do them within a narrow time window, they could go beyond the healthy stress threshold by overlapping these different stresses. Even though they're healthy, putting too many of them too close together, I could see how that could be too much for the body.
Yeah, that's exactly right, because stress is cumulative, and to the body, it doesn't matter if it's coming from fasting or exercise or the diet. Anything that is causing stress adds up. And the way that all these approaches work is through hormesis, which is the mechanism by which a beneficial stress damages the body temporarily, but then when the body heals, it comes back stronger and more resilient. So just like when you're lifting weights, you are slightly damaging the muscles, and that's how they grow, when they heal and recover. So with hormesis, if you get too much stress and combine like multiple different stressful things on the body, then it gets to the point where you don't get that benefit. So it can be counterproductive. So often, like that's why I see with intermittent fasting, especially in some of my female patients who have very busy, multiple roles, mother, busy professional, and plus other activities, then intermittent fasting is counterproductive because it is one more stress that then has negative effects for a person who's already stressed.
And how do you feel about using something like HRV as an objective measure to see how your body's responding to these different quote unquote healthy stressors and seeing where you're at on that continuum?
Oh, yeah, that's a great tool. I think heart rate variability is a pretty good metric for how your sympathetic and parasympathetic nervous systems are in balance. The sympathetic is more fight or flight, and parasympathetic is resting, digesting, rebalancing. And research shows that patients with autoimmune disease tend to be low in HRV, and that reflects typically higher sympathetic activation and lower parasympathetic. So as you incorporate more of those mind-body techniques, tracking your HRV through either a watch or an Aura Ring or other devices like Heart Math, there's a lot of different ways to track it, but that can be a valuable tool.
And when you talk about the nervous system, it gets me thinking about the parasympathetic nervous system, which ties into what we're talking about here, the rest and digest, and the vagus nerve, and stimulating that to cause that calming of the body. So can you talk about that nerve specifically and the physiology of stimulating that to cause that calm?
Yes, absolutely. The vagus nerve, vagus means wanderer in Latin, because this is one of the longest nerves in the body, starts in the brain and kind of meanders throughout the whole body. So has really widespread effects and is probably the main nerve for the parasympathetic nervous system, which is this beneficial rest and digest approach. And most mind-body techniques work through activating the vagus nerve and parasympathetic pathways, like meditation, guided imagery, relaxation, deep breathing. But there are other kind of hacks you can do to activate the vagus nerve. So cold water exposure is actually one of the powerful ways to do that, especially on the face. Cold, but to the whole body as well. But acute cold exposure really stimulates the vagus nerve. And then finally, I'll mention there are now vagus nerve stimulators that are implantable, which are being studied for autoimmunity. Very good initial research in rheumatoid arthritis, Crohn's disease. These devices are getting smaller and more effective with each iteration, but I think that might be a tool down the line that our patients with autoimmunity can benefit from.
It sounds very invasive, though, the fact that it's
Yes.
implanted instead of just something you can use and then put aside.
No, it is certainly invasive, and it's studied in patients that are drug refractory, so they've already tried multiple medications for their autoimmune disease, not able to get it under control. But in those cases, it might be worth doing something like that to help bring their symptoms into remission.
Got it. And you mentioned the cold water therapy. A great way for people to get started with that would be to end their shower with cold water. I've done this on and off over the years. It's one of those things that I found it hard to make it a regular practice ongoing because we can't deny the fact that it is very challenging. It's very painful, but ending that shower with 30 seconds of cold water would be a way for people to get started.
Yes, absolutely. Yeah. So it doesn't need to be like a full ice bath or, many of these devices that are there now, like a cold plunge. You can even, if you are in the wintertime, you can go outside without, a jacket. You get the acute cold exposure that way, or the shower. That's one of my favorite ways as well. Just 30 seconds of cold water at the end of a shower.
You mentioned trauma and mentioned that we could come back and go deeper into that. A lot of people, when they hear that word, probably think about things like physical abuse, sexual trauma, these big capital T traumas that, do happen, unfortunately. But let's talk about the continuum of trauma and how that can specifically impact somebody with autoimmunity.
Yes, for sure. So there are many different types of trauma. What has been studied are adverse childhood experiences called ACE scores, which have been, associated with dramatically higher rates of adult autoimmunity. So these could be things like, abuse or neglect or other challenges in childhood. But what the mechanism is chronic sympathetic activation. So what they find is the trauma, activates this fight or flight response, and if it's severe enough, then it can persist for decades, and over time, that leads to the inflammation and autoimmunity. So I think one of the tools for addressing trauma that is showing a lot of research is EMDR. Eye movement desensitization and reprogramming. This is a technique using eye movements that have been associated with different brain effects, and research on trauma is very promising with with incorporating that. I agree. I think other forms of trauma are more subtle. So, for example, racism, and this is why there are racial and ethnic disparities in autoimmunity. I think it's important to be aware, especially underserved populations, they have worse outcomes when it comes to autoimmune disease. And it's thought it's because of these negative effects of structural, inequality, racism, all of those things over time, can contribute to that sympathetic overactivation that leads to inflammatory changes.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
What we often see in autoimmunity are certain parts of the immune system are hyperactive. Those are the attacking the tissues, producing the autoantibodies, and other parts are actually suppressed, like the part that's supposed to